The Social Security crisis just got a lot worse. For years, you've heard the warnings. Social Security's trust fund will run out of money in 2034. At that point, unless Congress acts, all 67 million Americans who receive Social Security will face an automatic 24% benefit cut. That's been the official projection from the Social Security trustees for the past several years. 2034, 8 years away. But that timeline just changed. According to the Committee for Responsible Federal Budgets analysis published in October 2025, if you account for the effects of recent legislation and policy changes, especially immigration restrictions, the depletion date is no longer 2034. It's earlier, much earlier. And in July 2014, the Congressional Budget Office projected the Social Security Trust Fund would run out in 2030. That's right, 2030, just 4 years from now. The CBO's 2014 long-term outlook showed the trust fund exhausting 1 year earlier than previously projected, citing lower long-term interest rates and slower economic growth. At that time, the depletion date was 2031 in CBO's 2013 projection. By 2014, it moved to 2030. And now, with recent changes in immigration policy, fertility rates, and the impact of the One Big Beautiful Bill Act, multiple analysts are warning that the 2033 or 2034 depletion date could move even closer to 2030. Why does this matter? Because 2030 is 4 years away. If you're 59 years old today, you'll reach full retirement age in 2033. If the trust fund runs out in 2030, you'll be 63. Not retired yet, still working. And when you do retire at 67, your benefits will have already been cut by 24% for 3 years. If you're already retired, 62 years old today, you'll be 66 in 2030. Your benefits get cut immediately. 24%, $1 out of every $4, gone. And here's the key. This isn't a prediction about some distant future crisis that future generations will have to solve. This is happening in the lifetimes of people alive today. In fact, it's happening to people who are already receiving Social Security right now. 67 million Americans currently receive Social Security. That includes retirees, disabled workers, and survivors of deceased workers. All of them are at risk of a 24% benefit cut within the next 4 to 8 years, depending on which projection you believe. So why did the timeline move up? Why are we talking about 2030 instead of 2034? 3 reasons. First, the One Big Beautiful Bill Act, which Trump signed into law in 2025, reduced revenue flowing into the Social Security Trust Fund. The law extended income tax rate cuts and created a temporary senior deduction, which reduced the revenue generated from taxing Social Security benefits. That revenue normally flows into the trust fund. With less revenue coming in, the trust fund runs out sooner. Second, immigration. The Social Security trustees' projections assume a certain level of net immigration every year. Immigrants who work in the United States pay payroll taxes, which fund Social Security. But Trump's immigration crackdown has drastically reduced the number of people entering the country. Fewer workers means fewer payroll taxes. Fewer payroll taxes means the trust fund depletes faster. And third, fertility rates. The trustees extended the assumed recovery period for fertility rates by 10 years, meaning they now expect the U.S. birth rate to remain low through 2050 instead of 2040. Fewer births mean fewer workers in the future, which means less payroll tax revenue long term. All 3 of these factors are pushing the Social Security crisis forward in time. What was supposed to happen in 2034 could now happen in 2033, 2032, or even 2030. To understand why the crisis is moving closer, you need to understand how Social Security actually works. Social Security operates through 2 separate trust funds. The Old Age and Survivors Insurance Trust Fund, called OASI, pays retirement and survivor benefits. The Disability Insurance Trust Fund, called DI, pays disability benefits. According to the Social Security Trustees report released in June 2025, the OASI Trust Fund is the one in trouble. The trustees project that the OASI Trust Fund will be depleted in 2033. The DI Trust Fund, on the other hand, is projected to remain solvent through the entire 75-year projection window, ending in 2099. So when you hear about Social Security running out of money in 2033 or 2034, that's referring to the OASI Retirement Fund, not the Disability Fund. Here's how the trust fund works. Every paycheck, workers pay Social Security payroll taxes. In 2024, about 184 million people had earnings covered by Social Security and paid payroll taxes. That money goes into the trust fund. When you retire, the trust fund pays your benefits. For decades, Social Security collected more in taxes than it paid out in benefits. The surplus was invested in U.S. Treasury bonds, which earned interest. By 2021, the trust fund had accumulated $2.91 trillion in reserves. That's the highest it's ever been. But starting in 2010, Social Security's costs began exceeding its non-interest income. The program was paying out more in benefits than it was collecting in payroll taxes. For a while, the interest on the trust fund's treasury bonds made up the difference. But in 2021, total costs exceeded total revenues, including interest. At that point, the trust fund started drawing down its reserves. Every year since 2021, the trust fund has been shrinking. In 2024, the reserves declined by $67 billion to a total of $2.72 trillion. According to the trustees, the trust fund will continue shrinking every year until it hits zero in 2033. When that happens, Social Security doesn't shut down. Payroll taxes keep rolling in. Workers are still paying into the system, but those incoming taxes will only cover 77% of scheduled benefits. That's where the 23% cut comes from. 77% payable means a 23% cut. If you're scheduled to receive $3,000 per month in Social Security, you'll only get $2,310. $700 gone. Every month. For the rest of your life. Unless Congress acts to fix the problem. Now here's the key. The 2033 depletion date is based on the trustees' intermediate assumptions. Those assumptions include estimates about how many people will be born, how many immigrants will enter the country, how long people will live, how fast wages will grow, and how many people will claim benefits. If any of those assumptions turn out to be too optimistic, the depletion date moves closer, and recent policy changes suggest the assumptions are too optimistic. The trustees set their assumptions in December 2024 before Trump took office. They don't reflect Trump's immigration crackdown, which has already caused net immigration to collapse. They don't fully account for the impact of the One Big Beautiful Bill Act, which reduced revenue to the trust fund by extending tax cuts and creating new deductions. And they assume fertility rates will recover over time, which hasn't happened. All of these factors push the depletion date earlier. That's why some analysts are now warning the trust fund could run out in 2032 or even 2030 instead of 2033. The biggest factor pushing the Social Security crisis closer is immigration. And this is where Trump's policies have had the most dramatic impact. According to the Penn-Wharton budget model, which analyzed Trump's deportation policies, in July 2025, under all scenarios, Social Security funding would be depleted 6 months earlier than expected. 6 months. That's how much damage deportations alone can do to Social Security's finances. Here's why. Social Security is funded by payroll taxes. Every worker in America pays 6.2% of their wages into Social Security. Their employer pays another 6.2%. That's 12.4% total on every dollar earned up to the cap, which is $176,100 in 2025. When there are fewer workers, there are fewer payroll taxes. And when there are fewer payroll taxes, the trust fund depletes faster. Immigration is driving almost all of America's population growth and almost all of the labor force growth, according to Tara Watson, director of the Center for Economic Security and Opportunity at the Brookings Institution. Watson told Marketplace in July 2025, quote, "As we cut off that spigot, we're going to find that we have more old people per working age person. According to the Census Bureau, immigration increased by 1.3 million people in 2025, compared with 2.8 million in 2024. That's a drop of 1.5 million immigrants in a single year, a 54% collapse, and it's getting worse. According to a study by the National Foundation for American Policy, shared with Axios in October 2025, Trump's immigration crackdown is projected to reduce the U.S. workforce by 6.8 million people by 2028 and by 15.7 million by 2035. 15.7 million fewer workers. That's 15.7 million people who won't be paying payroll taxes into Social Security. Here's the irony. Undocumented immigrants paid $26.2 billion into Social Security in 2023 alone, according to the American Immigration Council. $26 billion. And most of them will never collect benefits because they're not eligible. They pay into the system using fake Social Security numbers or someone else's number, but the benefits end up with the owner of that number or simply stay in the trust fund unclaimed. It's a net positive for Social Security. Undocumented immigrants are subsidizing the retirement benefits of U.S. citizens. According to the American Immigration Council, 77.1% of foreign-born residents and 89.4% of undocumented immigrants are between the ages of 16 and 64. That's working age. Compare that to just 60.9% of U.S.-born individuals. Immigrants are younger, more likely to be working, and more likely to be paying payroll taxes than native-born Americans. According to the Penn-Wharton budget model, replacing the lost revenue from permanent deportation would require increasing payroll taxes by an additional $180 per year from the median U.S. household in 2025, growing at around 3.5% each year in the future. So when Trump deports immigrants, he's not protecting Social Security for American workers. he's undermining it. According to the Brookings Institution's analysis published in March 2025, immigration improves the federal budget because immigrants pay more in federal income and payroll taxes than they use in federal benefits. Removing immigrants from the labor force doesn't help Social Security. It accelerates insolvency. So, how did the One Big Beautiful Bill Act accelerate the Social Security crisis? According to the Social Security Administration's chief actuary, Karen Glenn, in a letter to Senator Ron Wyden published on August 5, 2025, the OBBBA moves the OASI Trust Fund depletion date from the first quarter of 2033 to the fourth quarter of 2032. That's 1 year earlier. And for the combined OASI and DI trust funds, depletion moves from the third quarter of 2034 to the first quarter of 2034. 2 quarters earlier, here's how it works. The OBBBA created a new $6,000 tax deduction for individuals age 65 and older. That's $12,000 for married couples. The deduction is temporary, running from 2025 through 2028. It phases out for single filers earning above $75,000 and joint filers earning above $150,000. According to the White House, this new deduction means that 88% of retirees will pay no federal income tax on their Social Security benefits. That sounds great for retirees. Here's the problem. Since 1983, revenue from the taxation of Social Security benefits has been earmarked for the Social Security Trust Fund. When retirees pay income tax on their Social Security benefits, that money doesn't go to the general treasury. It goes directly back into the Social Security and Medicare trust funds. This was part of the 1983 bipartisan reform that was designed to extend the life of Social Security when it was facing insolvency back then. It's a dedicated revenue stream. But the OBBBA $6,000 senior deduction reduces the amount of taxes collected on Social Security benefits. Fewer taxes means less revenue flowing into the trust fund. According to the chief actuary's analysis, the OBBBA will reduce Social Security's dedicated revenue every year starting in 2025. In 2025, the trust fund will lose $3.5 billion in revenue. By 2034, it will lose $21.6 billion in a single year. Over the entire 75-year projection period ending in 2099, the cumulative loss is $1.1 trillion. $1.1 trillion. And here's the cruel irony. The senior deduction is temporary. It expires after 2028 unless Congress extends it. So the government is giving current retirees a 4-year tax break from 2025 to 2028. But the cost of that tax break is reducing the trust fund's revenue, which accelerates insolvency, which triggers an automatic 24% benefit cut for all future retirees, including the same people who got the tax break. According to GovFacts, a nonprofit that analyzes government policy, the OBBBA creates a feedback loop. A short-term targeted tax cut for some current retirees is financed in a way that could result in a larger, permanent benefit reduction for all future retirees, including those who received the initial tax break. So if you're a 65-year-old retiree in 2025, you'll get a tax break through 2028. But in 2032 or 2033, your Social Security benefits get cut by 24% permanently. The tax break saves you maybe a few $1,000s over 4 years. The benefit cut costs you tens of thousands over the rest of your life. According to the Committee for a Responsible Federal Budget, because the OBBBA hastens the insolvency date, the automatic reduction that would occur in 2032 would be larger than previously projected. Beneficiaries would face an across-the-board reduction of approximately 24%. This is significantly larger than the 19% reduction projected under prior law. For a retiree receiving the average monthly benefit of $1,976 in 2025, a 24% reduction would amount to a loss of about $474 per month, lowering their monthly payment to $1,502. That's $5,688 per year, every year for the rest of your life. So what actually happens in 2032 or 2033 when the trust fund runs out? Social Security doesn't shut down. Workers keep paying payroll taxes. But those incoming taxes will only cover 77% of scheduled benefits. That's where the 23% cut comes from. According to the Social Security Trustees report released in June 2025, when the OASI Trust Fund is depleted in 2033, 77% of benefits will be payable at that time. That means a 23% automatic benefit cut. It's not optional. It's not up to Congress. It's built into the law. The Social Security Act requires that benefit payments cannot exceed incoming revenues. When the trust fund hits zero, the only money available is payroll tax revenue. And that revenue is only enough to cover 77% of promised benefits. According to the Committee for a Responsible Federal Budget, because the OBBBA hastens the insolvency date, the automatic reduction that would occur in 2032 would be larger than previously projected. Beneficiaries would face an across-the-board reduction of approximately 24% instead of the previous 19% projection. For a typical couple retiring in early 2033, that's an $18,100 annual benefit cut according to the Committee for a Responsible Federal Budget. As analysis published in July 2025, $18,100 every year for the rest of your life. Here's how that breaks down. According to Fox Business, reporting from June 2025, a single middle-income worker with career earnings of about $63,400 per year would see their Social Security payment decline from $3,275 per month prior to insolvency to about $2,592 per month after insolvency. That's a $683 monthly cut. Over a year, that's $8,196 gone. For a couple, double that, and the cuts get worse over time. According to the Social Security trustees, if no action is taken, the cut would grow from 23% in 2033 to 31% by 2099. That's almost a third of your benefits gone. By the end of the century, Social Security will only be able to pay 69% of scheduled benefits. But here's the thing most people don't realize. The cuts happen to everyone, not just new retirees. If you're already retired and receiving Social Security in 2033, your benefits get cut too. It's across the board. According to NPR reporting from June 2025, unless Congress acts, benefits for more than 60 million retirees and family members will automatically be cut by 23%. Current and future beneficiaries alike will see their benefits reduced. There's no grandfathering, no protection for people who plan their retirements based on the current benefit formula. The cuts apply to everyone receiving Social Security retirement benefits the moment the trust fund hits zero. And, according to analysis by CBS News from October 2024, that could prove devastating to both current and future retirees, with many of the former already financially stretched, and given that 4 in 10 seniors live solely on the average Social Security monthly benefit of $1,907. If your only income is Social Security and it gets cut by 23%, you're in poverty. According to the Committee for a Responsible Federal Budget, the automatic cuts would double the elderly poverty rate and reduce median senior household income by nearly 14%. So who exactly is at risk when the trust fund runs out? According to the Motley Fool's reporting from December 2025, Social Security's more than 70 million traditional beneficiaries will face automatic cuts. 70 million. That's not a small number. That's roughly 1 in every 5 Americans. Here's how it breaks down. The largest group is retired workers. According to the Social Security Administration's 2026 COLA fact sheet, the average retired worker beneficiary receives $2,071 per month in 2026. That's up from $2,015 in 2025 due to the 2.8% cost of living adjustment. But if the trust fund runs out in 2033 and benefits get cut by 23%, that $2,071 drops to $1,595. That's $476 gone every month, $5,712 per year, for the rest of your life. The second group is workers with disabilities. According to the Motley Fool, more than 7.1 million disabled workers received Social Security disability insurance as of November 2025. The average monthly payout for disabled workers in 2026 is $1,630. A 23% cut brings that down to $1,255, $375 gone every month. For people who are already disabled and can't work, that loss is devastating. The third group is survivors. These are widows, widowers, and children who receive benefits based on a deceased worker's earnings record. According to the Social Security Administration, the average survivor beneficiary receives $1,618 per month in 2026. A 23% cut drops that to $1,246. $372 per month gone. And here's what makes this especially cruel. Many of these people have no other income. According to NPR's reporting from June 2025, 4 in 10 seniors live solely on Social Security. 40%. They have no pension, no retirement savings, no investments, just Social Security. If that gets cut by 23%, they're in poverty. According to the Committee for a Responsible Federal Budget, the automatic cuts would double the elderly poverty rate. Right now, about 10% of seniors live below the poverty line. If Social Security gets cut by 23%, that doubles to 20%. 1 in 5 seniors living in poverty. And it doesn't just hurt current retirees, it hurts future retirees too. If you're 45 years old today, you'll reach full retirement age at 67 in 2048. But the trust fund runs out in 2033, 15 years before you retire. By the time you claim benefits, the system will have been operating under a 23% cut for 15 years. And according to the trustees, the cut gets worse over time. By 2099, it's a 31% cut. So if you're planning your retirement around the current benefit formula, you're in for a shock. The benefits you think you're going to get are not the benefits you're actually going to get, unless Congress acts. And right now, Congress is doing nothing. According to CBS News reporting from October 2024, fixing Social Security requires political courage that nobody in Washington has. Every solution raises taxes, cuts benefits, or both, and nobody wants to be the politician who tells voters they're getting less or paying more. So they're kicking the can down the road, and the clock is ticking. So can Social Security be fixed? Yes. There are multiple options. The problem isn't that solutions don't exist. The problem is that every solution is politically toxic. Option 1 is raise taxes. According to the Brookings Institution's blueprint published in February 2025, one way to achieve solvency is to increase the taxable maximum earnings to cover 90% of wages and slightly increase the payroll tax. Currently, Social Security taxes only apply to the first $184,500 of earnings in 2026. That's up from $176,100 in 2025. Everything above that cap is not taxed for Social Security. According to the Congressional Budget Office, about 6% of workers earn more than the cap. If you raise the cap high enough to cover 90% of all wages, you'd capture more revenue from high earners. But that's a massive tax increase on anyone earning above $184,500. And those are the people who vote, donate to political campaigns, and influence policy. No politician wants to tell them they're getting a tax hike. Option 2 is cut benefits. According to the Peter G. Peterson Foundation's analysis published in August 2025, the Social Security Administration has evaluated plans that would reduce benefits for newly eligible retirees. One option would reduce total benefits for all new beneficiaries by 5% starting in 2025. That would raise $134 billion over 10 years and increase the long-range 75-year actuarial balance by 18%. Another option would reduce benefits for high earners only. If your modified adjusted gross income is above $60,000 for single filers or $120,000 for joint filers, your Social Security benefit gets cut. But cutting benefits is political suicide. Seniors vote. And telling 67 million people their benefits are getting cut is not a winning campaign strategy. Option 3 is raise the retirement age. According to the American Academy of Actuaries, one proposal would raise the full retirement age to 68. Starting in 2023, the age would increase by 2 months each year until it reached 68 in 2028. This is estimated to fill 18% of the funding gap. Another proposal would raise the full retirement age to 70 by 2040. That would fill 44% of the gap. The logic is simple. People are living longer. In 1935, when Social Security started, 65-year-old men expected to spend about 13 years in retirement. Soon, men will live about 20 years in retirement. If you're getting benefits for 20 years instead of 13, the system can't afford it. But raising the retirement age is a benefit cut. If you were planning to retire at 67, and now you have to work until 70, that's 3 extra years of work and 3 fewer years of benefits. And it disproportionately hurts low-income workers who have physically demanding jobs. According to critics, low-earning workers have seen little or no gains in longevity. It's high earners who are living longer. Raising the retirement age for everyone just because wealthy Americans are living longer is a stealth benefit cut that hits the poor hardest. Option 4 is increase immigration. According to Brookings, raising legal immigration levels would increase the pool of tax-paying workers and ease workforce shortages. More workers means more payroll taxes. More payroll taxes means the trust fund lasts longer. The Penn-Wharton budget model estimates that reversing Trump's deportation policies and increasing immigration could delay insolvency by 6 months or more. But Trump just cut immigration in half. Net immigration dropped from 2.8 million in 2024 to 1.3 million in 2025. And politically, increasing immigration is a non-starter for Republicans. So we're stuck. Every solution requires political courage that nobody in Washington has, and the clock is ticking. So let's bring this all together. For years, you've been told that Social Security will run out of money in 2034, 8 years away. That gave Congress time to fix it, time to debate solutions, time to make the tough choices. But that timeline just changed. The Congressional Budget Office projected in 2014 that the trust fund would run out in 2030, just 4 years from now. And with Trump's immigration crackdown reducing the workforce by 6.8 million people by 2028. With the One Big Beautiful Bill Act cutting dedicated revenue to the trust fund by $3.5 billion per year, and with fertility rates staying low, multiple analysts are warning the depletion date could be 2032 or even 2030, not 2034. When the trust fund runs out, 70 million Americans face an automatic 23% benefit cut. That's $683 per month for the average retiree, $8,196 per year, $18,100 for a married couple, every year for the rest of your life. And it's not just future retirees. If you're already retired and receiving Social Security today, your benefits get cut too. It's across the board. No grandfathering, no exceptions. According to the Committee for a Responsible Federal Budget, the cuts would double the elderly poverty rate from 10% to 20%. 1 in 5 seniors would be living in poverty. And here's the cruel irony. The policies that are accelerating this crisis are the same policies that claim to help you. The One Big Beautiful Bill Act gave current retirees a temporary tax break from 2025 to 2028, but that tax break reduced revenue to the Social Security Trust Fund, which moved the insolvency date closer, which triggers the automatic 24% benefit cut. You get a small tax break for 4 years, and then you lose 24% of your benefits for the rest of your life. Trump's immigration crackdown was sold as protecting American workers, but immigrants pay $26.2 billion into Social Security every year, and most of them will never collect benefits. Deporting them doesn't protect Social Security. It accelerates insolvency. In my previous videos, I've explained how the United States has crossed into fiscal dominance territory with $38 trillion in national debt. I have shown you how tariffs are a hidden tax, costing families $1,500 per year. I've broken down how Trump accounts are funded by cutting health care for 16 million people. And now Social Security is on the chopping block too. It's all connected. The debt crisis, the tariff crisis, the health care cuts, the Social Security cliff. They're all part of the same fiscal catastrophe unfolding in real time. Congress has 4 options to fix Social Security: raise taxes, cut benefits, raise the retirement age, or increase immigration. Every option is politically toxic. Nobody wants to vote for higher taxes or lower benefits before the midterm elections in November. So they're doing nothing. And the clock is ticking. 2030 is 4 years away. If you're 63 today, you'll be 67 in 2030, right at full retirement age. And your benefits will already be cut. If you want to follow this crisis as it unfolds, subscribe to this channel. Because Social Security insolvency is not some distant future problem. It's happening to people alive today. Drop a comment. Do you think Congress will fix Social Security before 2030? Or are we heading for automatic cuts? Let me know what you think. And I'll see you in the next one.